do that intro in the comment section if you don't mind. It looks like Ashley may have already started when I was getting myself situated with the intro. So if you haven't already placed your introduction, just please do, what type of diabetes you have and your desired outcome in taking this class today. During the course of this presentation, we'll talk about, we'll do an overview as to what is diabetes and the benefits of things like healthy eating, exercise, monitoring, as well as medication. And then we'll talk about the SMART goals as mentioned. And we'll give you an opportunity at the end to just share some questions and comments so that we can address them. All right, so diabetes. Thinking, I can't see the chat, but I'm thinking that you all have diabetes. That's why you're here, to kind of talk about, goals related to diabetes. And what is diabetes exactly? So in a nutshell, diabetes is when you have too much glucose or sugar in your blood. And where does that stem from? We each have a pancreas, and the purpose of our pancreas is to make insulin, right? Insulin being a hormone that is responsible for keeping blood sugars in check, if you may. So if our pancreas is either not making enough insulin or not making adequate amount of insulin, it's going to result in a higher than normal blood sugar. And that becomes a problem because high blood sugar can cause damage. There are complications that we can see when our body, our cells, our nerves, our tissues are exposed to high blood sugars. So insulin is needed to be working to keep those blood glucose in control. And diabetes, once again, is a condition where that insulin is not adequately being produced or not working as it should. So, how do we manage diabetes? When we talk about managing diabetes, it involves not only, you know, taking medication, but actually healthy eating, being active, which is exercising, monitoring, and taking that medication. Those all have a role in getting the best outcome in managing your diabetes. So, healthy eating means eating the right amount of carbohydrates, protein, and vegetables. You will learn that carbohydrates is specifically that nutrient that affects our blood sugar. So, it doesn't mean that we have to avoid carbohydrates, but knowing the portion and the type to kind of include in our meals will help with our blood glucose results. Being active, very important as well. The American Diabetes Association recommends that you get in at least 30 minutes, 5 days a week. And, lots of people find that a little challenging. You can maybe, find maybe 15 minutes in the morning and 15 in the afternoon or in the evening works better for you. And that is perfectly fine, just as long as you're getting that 30 minutes in 5 days a week, then you are, pretty much taking care of your activity expectation. Monitoring helps you to learn how your body reacts to certain foods, medicine, sickness, and stress. There are a lot of patients who have diabetes who say, oh, I don't really check. I know when my sugar is high, I know when it's off. The reality is that's not always true. So, monitoring will give you that number and allow you to see not only what your blood glucose is at that given time, but also the trends on a day to day, you know, um, pattern to kind of see, am I always high at a certain time during the day, so that your doctor or your provider can kind of fine tune your treatment to address that. And lastly, medication, very important. Medication is not going to work if you don't take it. So if you are prescribed medicine for your blood sugars to be in control, it is important that you take it as prescribed. All right, so jumping into the essence of our presentation today. We're here to talk about goals and specifically SMART goals. And what does that mean? When I say a SMART goal, we're talking about setting goals that are specific, measurable, action oriented, realistic, and timely. And that is what entails what's called SMART goals. So, we can all say, okay, we have a goal, but if they're not fitting this criteria, being specific, measurable, action oriented, realistic, and timely, then it's not considered a SMART goal. And SMART goals kind of fine tune for you, if you may, specifically your desired outcome so that you can pinpoint if in fact you're obtaining your goal. Okay? So let's dig a little bit into the specifics for a SMART goal. So, first one, specific. So, let's say you had a goal and you wanted to exercise more. Just in the chat, if you don't mind, do you think my goal is to exercise more? Do you think that would be considered a SMART goal? Just a yes or no in the chat. I'd be very curious to see before we get into the specifics of it what you think. So, again, I had a goal to exercise, and if you were trying to make it smart, and I said,
Maureen, did you share your screen with us?
you're
Because they're
not seeing
saying
my
that we
screen?
can't see the presentation. I thought it was just
Oh no, it says it's sharing. You're not seeing it?
no. Hold on, let me see.
Oh, all along I've been talking, you haven't been seeing my slides?
No.
Oh no, yeah, it says it's sharing.
Here, let's.
It says Diabetes Association is sharing your screen, and it gives me an option to stop sharing.
Yeah, because I can't see it.
Hmm.
Uh, Hold on. Let's see. Someone is already sharing their screen. Maybe stop sharing it and then share it again. Wait, so I just started to see slide in the last 1 minute. I see it now. Okay.
You
Can
see my
everyone see it? Because
slides?
I can't see it, but if everyone can see it, then that's okay. No, they can't see it.
Uh,
Okay, I can't see it. I don't see it. There. Okay, we're good.
wow, so it's the same thing that I've been seeing all along. So should I go back because now I feel like you've missed? I've been talking.
Um,
Uh, okay. So, all right. So you've been hearing me at least, correct?
yes, we've been hearing you. I think
All right.
smart. Yeah,
All
let's
right
put
then.
it here. Setting smart.
All right. So setting SMART goals. So again, specific. We want to be specific when we're setting a SMART goal. And the example that I used is, let's say I said my goal is to exercise more. Do you think that would be a specific goal? And just a yes or no in the chat. I'm curious. Thank you, Kimball. Not specific, Andrea and Joyce. Good deal. Because it's not, right? Because it's not clear. I will ride my bike to work 3 times a week. There we go. That is more specific because it's giving us now an actual action as to what we're going to do, how many times, and makes it more specific. Or for instance, I will take the stairs every morning. That's more of a specific goal. So when we're making SMART goals, again, you want to be clear and concise as to what exactly you're going to do and how often, just to kind of make it specific to fit that category. All right. The second expectation in a SMART goal is that it should be measurable so that you can keep track of your progress. So, again, If I'm going to ride my bike, how often am I going to ride my bike, right? Am I going to do it twice a day, twice a week rather, 3 times a week? So go ahead and make sure you have a measurable point in that goal so that you can use that as a reference point to see how well you're doing or not. The goal should also be action oriented. So, for instance, a goal is something that you can do, not necessarily something you want to happen. So, for instance, you may say, I want to lose 20 pounds, but that's not the specific goal. The goal in regards to being action oriented should be what are you going to do to lose that 20 pounds? Okay, so make sure it's action oriented, it's related to something that you're planning to do specifically and measurably to be able to say how you're doing as you're measuring. Realistic. So when you're setting your goals, and we're going to get the opportunity to practice this, by the way, but when you're setting goals, uh, you want to be realistic, and I get it. We all want to be ambitious. We want to try and strive for the stars, but make sure it is something that is attainable, right? So most people really cannot run 2 hours every day. I mean, not most people anyway. So that might not be a realistic goal for you, but maybe something like 10 to 15 minutes daily or 10 to 15 minutes twice a day might be more attainable or realistic for your present, state. The last part of that expectation when we're talking about SMART goals is to make sure it's done in a timely fashion. So there should be a time aspect related to your goal. So let's say we go back to I will ride my bike 3 times a week. How long do you plan to keep that up? We don't want to leave it for eternity, but rather let's say for the next 3 months, I will ride my bike 3 times a week. And that will again fit that note as to that time factor. All right, so I'm kind of looking at some of the comments. David says, I'm 83 years old, type 2 diabetes, only in the past I've begun control, recent A1C 8.9. Okay, so thank you for that. Matrisa says, I'm already familiar with SMART goals in general. Okay, so today, Matrisa, we're going to go a little bit further in regards to those areas that we talked about, right? Like eating healthy, exercising, monitoring, and medication. We're going to ask that you choose one of those areas or all of those areas we're going to practice and just make a specific goal as to where you are today with managing your diabetes because we can always improve. No matter where we are, there's always room for improvement. So maybe you will be one of the participants that will kind of, learn from, if you may. You can maybe help anyone that is maybe struggling with the process of making a SMART goal going forward. All right. All right. When we're talking about healthy eating, it's very important. It's probably one of the high interest areas when we have patients in classes regards to diabetes and blood sugar control is what can I eat? What am I supposed to eat to keep my blood sugars in good control? And the reality is, when you have diabetes, it's not like you cannot eat. You can eat, but it's all about healthy choices of what you choose to eat and the portion controlling of your carbohydrates. So, when we're talking about healthy eating, once again, it's about incorporating the protein, the carbohydrates, and the healthy fat so that you're getting a good portion of each of those nutrients and not necessarily, you know, uh, forbidding yourself from eating something you like maybe a small piece of cake or a small amount of ice cream. Believe it or not, that's okay. in moderation. So it's about learning how to portion control, which we'll go into in the next few slides. So some tips. Eating is part of controlling your blood sugar, meaning when you have diabetes, it's not only about taking the medication, but the body needs the medicine to keep the blood sugars in control, and the medicine actually needs the food so that your blood sugars can stay balanced. If you take medication and you don't eat, or you're not eating properly, your blood glucose can drop, which in itself is another complication of diabetes. So you do want to, as I mentioned, include healthy protein, healthy carbs, and fat at meal times. Try not to skip meals. Try to eat every 4 to 5 hours. I get a lot of patients who say, I'm not a breakfast person. I don't really like eating breakfast. The problem with that is diabetes, especially when we're talking about type 2 diabetes, is a metabolic disorder. And by skipping a meal, it's actually interfering with your metabolism of your blood sugars. So it is important, even if it's not a big meal, that you are getting your required nutrients throughout the day in approximately every 4 to 5 hours to keep that metabolism and your blood glucose in sync. Try to keep a snack with you in case you do need it in between meals, especially if you're on things like, glucose lowering medication like insulin or glipizide or glyburide. And you do want to try to eat around the same time every day just to help out. So, healthy meal planning. What does a healthy meal look like? So, we always refer to, when we're talking about diabetes meal planning, the plate method, right? And the plate method is pretty much where you have a plate. And again, you're trying to incorporate those three nutrients that I said are kind of expected and suggested, which is, again, your protein, which is in this case a piece of salmon, your carbohydrate, which is some brown rice here, and your green leafy vegetables, which are considered free, and your veggies or your starchy vegetables here just is another serving or a low serving of low carbs. So the fat, which would be also an expectation on your meal, could come in the form of maybe your salad dressing, a low fat salad dressing, or maybe the olive oil that's used to, cook that salmon. So, just again, being mindful of those three nutrients. Once again, healthy protein, carbs, and healthy fat at each mealtime consists of what we call a healthy meal. Okay, so Andrea, snack examples, please. Well, what do you like, Andrea? What do you like? I'd like to start there because I feel like telling you, uh, okay, thank you, fruit. So, it's not about getting you to eat what I like. It's always about working with you and just trying to modify, if anything, to make sure you're enjoying your meals, but yet kind of keeping your blood sugars in check. So, fruit. So, I'm so happy you brought that up. So, fruit happens to be a carb, right? So, carbohydrates are things like your bread, your pasta, your rice, your potatoes. Fruits are carbs. Your sweets, such as your cakes, candy, and all of those things, including fruit, is allowed, but in moderation. So let's say you wanted a fruit for a snack. I would suggest that you have what's considered a small apple. So something that can fit in the palm of your hand would be considered a serving size for fruit. So a small orange, small apple, a small peach would be considered a serving, which is consisting of 15 grams of carbohydrate. Now, if it's a medium or a large fruit, you do want to cut it in half. And again, just a serving size is what you want to stick to if it's going to be used as a snack which is again a small fruit, which is again equivalent to what can fit in your hand, or half of a medium or a large size fruit when we're talking about fruits. And any fruit, we can share with you. Maybe I don't know if we can have access to just go through what's considered carb counting in another opportunity where we will share with you what consists of a serving. So you don't necessarily have to use the glycemic index, Andrea, but just knowing maybe if you're using grapes, it's going to be probably 15 grapes that's considered a serving. So it's about the amount as opposed to the fruit itself that you want to be mindful of when you're trying to portion control. All right, so once again, this plate is an example of what you should be striving for at meal times when you're eating. Lots of us grew up with the notion of, well, I did anyway, where the half of the plate was pretty much the starch, and we found that too many, too much starch is really what pushes that blood glucose level over the top and kind of, you know, shakes that balance. So again, try to have your plate filled with green leafy vegetables or whatever vegetable you like. And the other half of your plate is split between your protein and your carbohydrate. So this rice could in fact be maybe half a potato. It could be you know, a quarter size of a plate of pasta. It could be quinoa. So again, just follow this plate method and it will dramatically help you. At least it has helped so many other patients in just what's considered portion controlling. All right, so here's your opportunity now to just kind of focus on a goal regarding healthy eating. So we're going to go through each of those different diabetes management areas: eating, exercising, monitoring, as well as medication. And the first one is in eating. So wherever you are today, think about what you would like to improve in how you're eating, what you're eating, when you're eating, and go ahead and set it in a goal. So that first line where it says, my health goal is, I want you to remember the criteria of what a SMART goal is. So try to make it specific, right? Make it measurable, make it action oriented, make it realistic, and make sure you remember to put that time factor on it. How long do you plan to continue this action to attain that goal? So just take a quick minute. And Ashley, I don't know if you'd like them to actually save a goal for your purpose, or is it okay for them to just maybe voice this online and we could have an interaction of them just sharing that?
Yes, this can be a personal goal. Just because I'm not sure if like how
Okay.
we're going to keep
All
track
right.
of these goals. So make sure that this is a personal goal of yours, and just hold yourself accountable and
All
see
right.
if you can achieve it. But yeah, you
And
can share it online
yeah.
in the
All
chat.
right. And if you feel more comfortable, are they able to talk?
Talking just so that we could save some time.
Got it, got it. All right. So if you feel comfortable with the goal setting, feel free to kind of share it in the chat as to what your health goal is regarding healthy eating. And we can just kind of maybe just dissect it a little bit just to see how well it fits that SMART criteria. When you're making your goal, I want you to also consider, in order to meet this goal, what will be necessary. Like, for instance, if I plan to exercise 3 times a week, I may want to make sure that, I have the right running shoes, right? Or I may want to make sure I'm home in time so that I can get that walk in before it's dark. Things of that sort. So think about not only setting that SMART goal, but in order to meet the goal, make sure you have, um, you're looking at all the things that are necessary to make that goal successful. The opposite of being successful is, we can meet up against barriers, right? There may be things that may, um, you can foresee that may actually prevent you from being successful at accomplishing that goal. So if in fact you foresee something, kind of think about it ahead of time, because if you can foresee that barrier, then you can now, before actually starting the goal, kind of think of ways to overcome the barrier before you get started to set you up for success. So Joyce, thank you for sharing. You put to eat more, healthy, and exercise. So I wanted just to focus on eating in this part because we're actually going to go through each different areas of that, managing diabetes. So just focus on eating for this exercise. All right, Esther, thank you for sharing. You have, I will eat breakfast at least 3 times a week for the next month. Now, I want you guys to just share. Do you think I will eat breakfast at least 3 times a week for the next month fits that SMART criteria? Because I think it does. I think that's perfect, Esther. It is smart in that it is specific. You're going to eat breakfast. You're going to do it 3 times a week. It is measurable because at the end of a month, if I say, "Oh, did you eat 3 times a week or did you eat 2 times a week?" We can measure it that way, right? It's action oriented because it's telling us exactly what you plan to do. It's realistic because I'm thinking that you're probably not eating breakfast at all right now. And it's timely. It's giving us that next by next month. So you're giving yourself a month to incorporate breakfast in your daily routine. So good job, Esther. Thank you. All right. So moving on, when we talk about, oh, let's go back, exercise, the American Diabetes Association recommends that we exercise, as I mentioned earlier, 30 minutes, 5 days a week. So, you know, for those who have not exercised, maybe 5 days a week is not the best thing to do right now. Maybe starting off with 15 minutes 3 times a week and then progressing to maybe 15 minutes 5 days a week and then slowly working your way up to the recommended timing. So very, very important for those people who have not exercised. You do want to make sure that you check with your doctor before starting any exercise routine, right? Make sure there is no restrictions and that you can, in fact, walk, jog, or do what you plan to do with no risk. So do make sure that's in place. Um, if your blood sugar is low, especially if you are on glucose lowering medication, it's important to make sure you eat to get your blood glucose in target range before exercising. And we'll talk about what target range is. Just keep in mind that if you are not exercising, it is something that you should be doing. Some of the benefits you're going to see from exercising includes things like lowering your blood sugar, it lowers your blood pressure, it lowers the cholesterol, as well as lowers weight and stress. Because when we exercise, we actually release what's considered endorphins, which are those feel good hormones that help us to be less stressed, feel better. So, definitely, if you're not exercising for these reasons, I strongly, strongly encourage you to start slow and make this part of your daily routine. All right. All right. So, oops, oops, oops. Here's our opportunity now. We talked about healthy eating in the last slide. Now let's make a goal. Same thing about exercising. For those of you who would like to improve your activity level, think about something that you'd like to do that you're not doing right now that would improve on how active you are. Once again, keep in mind that it should be specific, measurable, action oriented, realistic, and timely. And feel free, I would love to see someone just share that goal with me. Someone other than, let's see, we had Esther, who did such a good job with eating. Someone else, if you don't mind sharing your SMART goal with activity or exercise once you get it in. Thank you, Matrisa, for your healthy, your SMART healthy eating goal. I'm so happy you guys got it. Matrisa said, I will eat 3 times a day by adding leafy green vegetables to at least 2 meals per day. I would just encourage you, Matrisa, to go ahead and add that time factor. How long would you like to continue this goal? Do you want to do it for the next month, for the next, 3 months? But right. So thank you forever. That's a good goal. But when we're talking about SMART goals, we like to put a time factor, and you can always re up your goal. But just so that you can hold yourself accountable at the end of that time frame, in 3 months, you could say, wow, I'm really doing well. I'm just going to continue. This is now my new lifestyle. So thank you. 3 months sounds like a winner. Okay, good deal. Good deal. All right. So, in regards to exercise, let's see, we have Pamela. Thank you, Pamela. Pamela said, I will walk 30 minutes a day, 5 times a week for the next 6 months. Wow, that is pretty ambitious. I'm curious, Pamela, are you walking at least any amount of time right now, or is this something new for you, this walking? All right, and we'll come back. Um, let's see. Joyce said, I will take strength class once a week and walk twice a week, 45 minutes. Again, Joyce, go ahead and add that time factor. How long do you plan to continue that? Do you plan to do it for the next month, for the next 2 months, or the next 3 months? Let's give ourselves a 90 day max for our goals. Um, Danny said, I will walk my dog 15 minutes per day, 5 times a week for 2 months. Perfect, Danny. You got it. That is such a smart goal. Thank you for sharing that. Let's see if I missed anyone. Andrea, I will wake up and use my elliptical 25 minutes, 3 times a week, Monday, Wednesday, and Friday, for 2 months. Wonderful. I think you guys got it. Now, the trick is going to be think about these other areas. In order to meet my goal, what do you have to do? Do you foresee any kind of barriers that would prevent you? Because these goals sound really good, but do think about anything that would get in the way of you accomplishing these goals and try to address them before they happen so that, you set yourself up for success. All right, the next topic is monitoring. So, monitoring helps you to learn how your body reacts to certain foods. It also gives you feedback on how well your medication is working, right? Do you need to make an adjustment? Or is that dose that you're on keeping you in target? It also helps to give you feedback as to, hey, I'm doing everything right, but my blood glucose is just out of control. It may mean you are having an infection, which could be a sign of, that's something that will cause your blood sugar to elevate. So just monitoring on a regular basis helps you to stay in control as to knowing how your body reacts to different things such as foods, medication, stress, and illness. So, when we're talking about target goals, these are the goals that are set by the American Diabetes Association. And for fasting or before a meal, so before breakfast, before lunch, before dinner, you're aiming for blood sugars between 80 and 130. Is it always going to be there? No, but that's where you want to be most days. That's considered target. Now, if you do happen to notice that your blood sugars are higher or lower, again, that's good feedback because if you're finding that your blood glucose before a meal is high, that tells you that either you got to look at maybe what did you eat, what did you drink, or did you forget to take your medication? Those are some common reasons your numbers may be high, right? If it's too low, it could be that you took your medication, like if it's less than 80, you took your medication, but you probably didn't eat as much, or you didn't eat at all, or maybe you exercised and you didn't kind of compensate a little bit more. So that gives you an idea as to how well you're sticking to target based on these ranges. So 80 to 30 before breakfast, lunch, and dinner. And if you want to just check in to see how your numbers are doing after a meal, try to remember to wait 2 hours after the first bite. Because if you check right after a meal, it will be high. Okay, so 2 hours after the first bite, as long as it's less than 180, that's reassuring. If it's in the 200s, then yeah, either your carb content was a bit too high, or you didn't take your medication, or you're not on the enough of the medicine that you need. It's good feedback. Okay, all right. So here we go again. For those of you who are monitoring, and I didn't get a chance to see if we're all monitoring, but I'm assuming because you have diabetes, you should be. Go ahead and use this. My health goal related to checking. So let's say you're not checking, or you're only checking once a day. I would really encourage you to maybe start checking twice or three times a day. So up it a little bit. And the rationale behind that is if you're only checking once a day, guess what? You only know what your blood sugar is doing once a day. And the reality is, our blood sugar fluctuates throughout the day, right? So you want to be able to have a good pattern as to how does my blood sugar hold up in the morning? How does it hold up in the afternoon? How does it hold up in the evenings? And enough of those readings is what's going to give you good feedback as to how well you're really doing. So I have patients who said, yeah, I check every morning. But every morning is just telling me how you're doing every morning. It's not really telling me how you're doing in the middle of the day or later in the evening. So, they may say, my blood sugar is so good in the mornings. It's so good. It's less than 100 every morning. But they go in, their A1C is really high, and I can't figure out why. It's because you're probably not capturing those high numbers later on at different times of the day. So it's to your advantage to do some spot checks either before breakfast, before lunch, or before dinner, and also before meals to get some feedback how your numbers are holding up. All right, Matrisa, what do you do if you're not in Target before meals? That's good feedback for your doctor, Matrisa. Again, before your doctor, though, look back to see if it's possible that you're maybe eating way too many carbs at mealtime. So maybe if you're high before lunch, look back to see, is it what I had at breakfast? Did I not take my medicine at breakfast? Was I late to take it? Once you rule those out, then you can definitely share that information with your doctor to see if maybe an adjustment is needed with your medication. So again, uh, yeah, I use the Freestyle Libre. Danny, I love that. I hope you're liking it too. Check blood glucose before meals and about 2 hours later to adjust my Novolog. Okay, okay, all right. And the good thing with the Freestyle Libre is it actually gives you feedback as to your average. It tells you when you're in range, when you're too high, when you're too low. It alarms when you're getting high or too low, which also keeps you on your feet. So that's a good thing. All right. I don't think I saw any goals for blood sugar. So I'm hoping that you guys, because you did so well with exercising, that you have it. And if this is a goal that you have, please feel free to set that goal and go ahead and, follow through with this. All right. All right. Medications. The next area, the last area actually. Our bodies make glucose, right, from the foods that we eat. So when we eat, food turns to sugar or glucose and it ends up in our blood. And that's not where we want the glucose to stay. High blood sugar is an issue, right? So we want that glucose to get into cells so that we can get energy. And that's where insulin or medication kind of comes in to help allow that process to happen. So insulin or the medications that you're taking is allowing that glucose to leave the cells and get into leave the blood and get into the cells so that we can have energy. So very important that the medications that you're taking it as prescribed, because I always say medications don't work if you don't take it. If it's something that is not sitting well with you, it's kind of making you sick, then that's feedback that your doctor needs to know, because it could be an education opportunity. Maybe it means, like for instance, if you're taking metformin and you're always going to the bathroom, it makes you feel sick. It could be, you know, you're not aware that it should be taken with meals as opposed to an empty stomach. That can make a difference. Also, making sure that you're minimizing things like your fried foods and fatty foods when on metformin, because that kind of aggravates those symptoms. So things like that. And if it's really bad, then your doctor may look at options. So definitely don't just not take the medicine, but share that information so that your doctor can find a better fit for you if needed. So, medication. Let's go ahead. I know this is a big area as well. I would like you all to just go ahead and write a SMART goal, if you don't mind. Take a minute or two to write a goal as to your medication. And it could simply mean that um, for the next 3 months, I will take my medications as prescribed, which is maybe twice a day with meals for the next 3 months, but something pertaining to your medications. And it could be a maintenance goal, meaning you're already doing it, but you just want to set this goal so that you can keep yourself accountable to stick to this action. Or maybe you're not. Maybe you're not taking, you're forgetting to take your medicine every so often. So your goal would be, I will set an alarm to remind me to take my medicine every day for the next month, something of that sort. So take a quick minute and just complete that. And while I'm waiting, is there anyone here on metformin on the panel? Yes. Kimball, and oh wow, lots of people, lots of people. So that side effect that I mentioned, how do you feel about it? If that's an issue, do you find the suggestion as to maybe taking it with a meal, something that you haven't been doing? And if so, I encourage you to do that. Um, Also, it could mean that you need a lower dose, meaning if you're taking 1,000 milligrams, talk to your doctor to see if maybe 500 milligrams for maybe a week or two, and then gradually going up to 1,000 might be beneficial, things of that sort. So I say that because that's a very common, um, you know, complaint about metformin, and it's very important because a lot of people just stop taking it, and it's not going to help you if that's what's going on. All right, so I use the Freestyle Libra. Check, yeah. We talked about that. I'll take my medications daily at 2:30 for the next month. Thank you, Kimball. And Danny, I use an app called J to calculate my insulin dosage. My endo sets the values for Novolog based on carbs being eat. Gastroparesis slows down digestion, and typically I add Novolog about 2 hours after. How's that working for you, Danny? What was your last A1C, if you don't mind sharing? Is that regimen working? I will fill out my pill box with my weekly meds for the next month. Thank you, Matrisa. Good deal. Crohn's and check 10 to make me anemic. So A1, okay, so you're not going to get an accurate A1C. Uh, okay, very good. All right, and once again, think about any barriers, that you may find. Oh, I don't get to see my doctor for next month, so how am I going to address this? You can always call the doctor's office, speak to the nurse. They can advise you over the phone. So think about these things and ways that you can kind of overcome it. Okay. All right. Questions. We're right at the at 4 minutes. Okay. Danny, A1C was 7, somewhat questionable due to the anemia. Okay. All right then. Thank you. All right. So please do share questions, feedback in regards to SMART goals. Please remember these goals were kind of this presentation was kind of put together to help you to know not only to set a goal, but to make sure it's smart. Because once again, SMART goals can shape kind of like a roadmap for your desired outcome, right? Because if you know that this is what I need to do, and I said that I'm going to do this, you're going to be the one holding yourself accountable. Oh, I told them I was going to ride 3 times a week, ride my bike 3 times a week. I'm only riding once a week. Then it's up to you to kind of get back on track. And you have to think about the long term effect. You're trying to what? Improve your overall management of diabetes, which is to keep that A1C down and minimize the risk of the complications. All right. So please, again, if there are questions, please feel free to share it in the chat. We do have a minute or two. Danny, you're going to resist the urge to eat high carb foods when I get stressed out for the next month. I appreciate that, but I do foresee a barrier. What happens if you get stressed? What are you going to do, Danny? That's what I mean. You got to think about like putting a plan in action, because the reality is life is stressful, right? So what happens if you do get stressed? How are you going to resist that urge specifically? Let's make it specific, Danny. Well, think about it. It's just food for thought. All right, Ashley, did you have any additional? Uh,
I don't have any questions. I'm just waiting for people to.
Danny,
Yeah.
grounding exercises. Grounding exercise. I'm trying to understand. Is that how you're going to resist it? Resist the urge? Do you
I think it means
recommend
like exercising is known for reducing stress. That's
exercise in general is known to reduce stress? So as I mentioned, maybe just increasing your exercise regimen. If maybe that wasn't a goal, maybe incorporate including exercise on a regular, just to minimize stress. That will ultimately probably help you to have to resort to those high carbs. Matrisa, do you recommend intermittent fasting for type 2? I can only recommend what the ADA guideline recommends, and I don't really recall them including that in their studies. So it's hard for me to really comment on that because I'm not that familiar with the actual outcomes of that. But I've heard lots of people say that it works. As long as you're, again, remembering those basic concepts, which is eating 3 to 4 times a day, um, taking your medication, exercising, if those can go along with those guideline recommendations, then, just definitely always talk to your doctor. That's going to be my safe answer. Matrisa, maybe I will go outside to play with dogs before reaching for an ice cream bar when I'm stressed. And they say that if you do something enough, like if you do it 3 or 4 times, in a week and it becomes routine, then before you know it, it's a habit and then it's a new habit. And then it's probably a lifestyle change that will make a big difference. So thank you all for being present. And I pray that I hope that this was useful and helpful. And I wish you luck in attaining these goals that you set with us today. Okay?
Thank you so much, Maureen. And thank you everyone who joined and participated. These classes are provided to you guys for free because we care and we want you to all, learn new helpful tips on how to manage your diabetes better. Just a reminder, Wow Wednesday is every fourth Wednesday of the month, and we hope to have Maureen in the future if she is willing to come back. Uh, we'll get another invite. Yes, closer to the date, we will promote Wow Wednesday on our social media pages, and we will send blast emails. If you guys want to follow us on our social media like Instagram, Twitter, or Facebook. It's Diabetes Atlanta. But you can also frequently check our website, diabetesatlanta.org, and it's usually updated in the web banner, the next class date and the time and how to register. Okay. I think, yeah, I think that's all the questions. We have one more question. What is the connection between stress
Stress
and
and
high?
high carbs. Uh, it's just it's a matter of satisfying, something that doesn't feel good, right? It's just the body's kind of like reaction to something that doesn't feel good. You're trying to appease it, right? So, that's why you want to try to incorporate stress relieving activities. So, anything that's going to help you to release those endorphins, is what's going to be helpful. So, exercise, again, I strongly recommend it. If you're able to exercise, get into exercise, whether it's Pilates, whether it's yoga, whether it's just anything that's going to get you moving to help to reduce the stress, which will ultimately help you to make better choices with your intake. Okay? All right. We'll see you next time. And thanks again for joining. Okay?
Thank you, Maureen. If
You're
you guys
welcome.
want to see
Dancing, yes, Martrisa. Yeah. All
if
right.
you guys want to share this presentation with someone, it will be uploaded to our YouTube channel probably in the next few hours. But yeah, thank you so much. Everyone have an amazing day, and we'll see you guys next month.